Hello, I'm Eduardo Huesca. Thank you for having me. I work for the Occupational Health Clinics for Ontario Workers. So in collaboration with the Dalai Lama School of Public Health in Glomie, we've helped to put together this forum. So thank you very much for coming. I've been asked to talk a bit about, to share a bit of information about a collaborative project that we are taking on with some key partners, including BISHOC and the Institute of Work and Health, among some others that I will mention as well. We are hoping that the information I'm going to share ties well into the conversation so far, because core of this project is really to continue understanding the experiences, the on-the-ground experiences of newcomers and refugee workers. As well, the IWH report that BISHOC mentioned was really a strong catalyst and momentum builder towards this project and pushing for this coming together of agencies and collaborators. So I just did want to start with a few before I get started, a few clauses, but this is a very new project. It's actually still in the works, so we're still assessing and we're still thinking about it. Tomorrow I actually have a workshop with a settlement agency in Hamilton to present this workshop that's basically under this project with them. So it's a lot new, and I think this is the first time that we've actually spoken to others, to an audience like yourselves. Also, I'm a bit of a late addition to the plenary, so I'm sorry if my slides are not the nicest. They're a bit rough, but I'm hoping that they communicate the information that's key. I also wanted to make sure to note that I definitely don't want to center or situate this project as any type of solution to the experiences that we're hearing from both in this plenary as well as in all the sessions that we had yesterday as well, and that we're going to have today. Really, as you'll get to hear a bit more about in my presentation, there's so much work to be done to actually ensuring that their supports and resources are actually effective on the ground. And also, there's amazing work happening, from agencies and partners beyond this collaboration, right? That some of which the work might actually be more extensive and further going than our work. So as part of this project, we're really focused on bringing in other partners and really hearing what's going on the ground and collaborating. So having said that, though, we are very excited about this project. It is a collaboration between occupational health and safety agencies that are working on the ground, as well as research institutions like IWH. So that coming together is definitely a very exciting one. Similarly, we have at the table WSIB and the Ministry of Labor collaborating, as well as noting that they're there open to really hear what really needs to change and what really needs to fall under their responses for change. Okay, so I'm just going to start in terms of just a couple slides explaining a bit of my experience, where I'm coming from towards this project. So again, I'm the coordinator for the Migrant Farm Worker Program with the Occupational Health Clinics for Ontario Workers. So some of my colleagues, it's a very collaborative program, and some of my colleagues are in the room, including Michelle Tu. Valerie Wolf directs the program, and as well as Patricia and Tracy and Leslie that work out of our Toronto clinic as well. One of our physicians, Dr. Donald Cole, is also in the second row. So he is one of the physicians that really staffs and pushes forward our program as well. So the program basically consists of us connecting to migrant farm worker communities across Ontario. And before my time, this program really emerged from unions and community groups engaging with staff at the occupational health clinics for Ontario workers, and really identifying that there was a need for resources and services and occupational health and safety support for these communities. So basically this then turned into us initially just driving out to communities with physicians and nurses and some of us to run mobile health clinics in accessible locations for migrant farm worker communities. So some of our health clinics included running them in community centers, churches, wherever we really could be connected to the community. So this had us basically driving around across Ontario to go to the main agricultural hubs where people are arriving. So in terms of the clinics, what we would see clinically, this is a chart we often put up to kind of communicate the main occupational health issues experienced by migrant farm workers that we see at our clinics. So this is very similar to a lot of the findings that the community health centers that are working with these communities are also seeing. And it makes sense in terms of the type of work that they're doing, very physically demanding work. So we see musculoskeletal and MSK issues at the top, followed by other issues that are really connected to the type of hazards that people are encountering. So what we in our project do is by really, and again, our mobile health clinics are really not meant to provide any type of consistent or ongoing care for these communities. Unfortunately, it's beyond our scope, but that's why it's been so great, the momentum and capacity building of community health centers and family health teams that have really stepped up and really started servicing these members of their communities. But for us, what this really presents itself is a learning opportunity to really identify what are the key issues that are affecting communities for us to then be able to plan interventions, gather resources, and figure out strategies to then really try to prevent these conditions from affecting these worker communities. So that takes us to developing workshops, going to health fairs, going to any kind of community events that are hosted by churches, community groups, and where migrant farm workers are arriving to. So these are some pictures of workshops that we've done both on the community level or on some of the farms at the invitation of employers, as well as some information fairs that we've set up. One soccer game that happens in Niagara every year, and we show up with our resources. So again, the issue, and this is not really related to the project I'm here talking about, but we do have a lot of experience working on the ground, and I think that's what we hope that we're bringing to this project in terms of collaborating with our partners. We did end up having a bit of experience taking what we've learned from our work with temporary foreign workers to then starting to present some information and resources to newcomers and refugee workers. So we piloted some workshops in Guelph, Ontario, and there was actually a presentation yesterday by the Guelph Settlement Agency that we collaborated with on this project. And so it was our first introduction to really starting to get connected to more of what's happening with newcomer and refugee workers. So our initial presentations were to Syrian refugees in terms of sharing information on their rights and responsibilities under the Occupational Health and Safety Act and what the responsibilities of their employers, what they should actually be expecting from their supervisors and employers, and just further information on how to connect to the Ministry of Labour, how to report information in situations where their concerns are not being addressed at their workplace, and information of that sort. So in terms of the current project that we're working on, it really came out of a partnership, or it came out of a program from the Ontario Ministry of Citizenship and Immigration. So it's a program that basically was providing funds for settlement agencies and employment agencies to include occupational health information into their regular settlement services. So again, as I'm going to touch on, and as Bashak mentioned, a lot of this really came from IWH and their recommendations and built from that momentum. So again, MCI, the Ministry of Citizenship and Immigration, identified that settlement agencies are increasingly working around occupational health or labor concerns of their clients as they're working around settlement settlement services. The response was that though a lot of settlement agencies were really well versed with this information or had been supporting their clients around occupational health issues for quite a lot of years, others had not. And so through this channeling of funds, there was the creation of new positions within some settlement agencies and employment agencies to really have staff that are tasked now to provide occupational health and safety information. So what then happened was that some of those agencies came back and said, great, there's funding, we can hire people, but we don't have the capacity. And similarly, how Bashak mentioned, what was happening then is the responses or the type of information was being presented very ad hoc, and in some situations very good quality. I definitely don't mean to downplay any of the work, but again, you had situations where agencies had been presenting this information for years, other ones that hadn't. So it was so what we're finding is it's varying across the board. So I put the Institute of Work and Health's logo there as well, or so basically the connection with MCI then approached the Ministry of Labour as again saying, we are finding that our settlement agencies don't seem to have that capacity. So, the MOL, can you help us with that and sharing information about your system, the prevention system, and any resources from agencies under it. And so that's it was that kind of inter-ministry collaboration that really started this project. But again, I put IWH's logo there because it was really a lot from the recommendations and the momentum built from the report that Bishak spoke to. So basically, we were identified by the MOL, again, a bit through, I guess, our experience. We were wondering why at the beginning. We were happy to be included, but it was funny. We felt like we fell into it a bit. But it really came from, again, our experience on the ground working with communities. But this was really from the get-go, we identified that this had to be a collaborative project to include as many occupational health and safety agencies as possible. So here are the logos of the agencies that are collaborating on this project. So the Institute of Work and Health, WSPS, Workplace Safety and Prevention Services, ourselves, and as well as I mentioned, WSIB and the MOL prevention system was also at the table, as well as Christy Eve, the vulnerable workers specialist at the MOL as well. So I guess the first wave of this project was really to come together and really pool what kind of resources we all had available around that were already thinking about the particular needs of newcomers and refugees, to kind of almost make an inventory of resources and strategies, and then to develop a slide deck or develop a presentation or a workshop. So initially we really didn't know what it was going to look like, but that was kind of the first idea, is to say, people are looking for resources, and we really need to make sure we're not working in silos and all separately, and just come together and see what we all have and figure out what we're going to offer to settlement agencies under this program. So I kind of put up the title again because initially this was framed as, you all are really tasked with developing a train the trainer, and what we're hoping to do is you land and you basically train people on what to do. And of course we kind of got really nervous about this, and we said, that's not really going to work, and that's not really the strategy that we're really wanting to take. And as we know from agencies that are working on the ground, none of this, there's not very, unfortunately, there's not very clear or clean solutions to a lot of the concerns experienced by newcomers and refugee workers. As I'm going to get to, even the resources that we have, how they actually function on the ground is far from perfect, and often leaves people falling through the gaps. So really, we organized this in a different way, and we tried to really capture this with the title, noting that, of course, this workshop was focused on supporting newcomers, but that the key was that collaboration component. So we really wanted to, connect with the settlement agencies that were under the MCI project, but really hear from them on whether they have been sharing this information, whether they haven't, what kind of resources they have been using, what they found are working, what they found are not working, and really then increase our understanding, bring it back to the system, pressure the MOL, pressure WSIB in a very collaborative way, but really then respond and come forth with things that are actually working. And so again, it wasn't anything about landing there and then trying to just implement what we thought was the solutions. But at the same time, we did really want to show up with something. We didn't want to be completely not useful to these settlement agencies that were being gathered for us to engage with. So again, that bringing together the resources that we do have available was really focused on offering these as tools and resources to build capacities, especially among those settlement agencies that were really just entering or that are really just entering the role of sharing information with their clients. So again, this is pretty new. So we've under this project we've basically ran 3 workshops, and the idea was to cover as much, or to cover Ontario as possible. So we had a workshop in Ottawa that captured the eastern region. So there was people coming that were not necessarily just from Ottawa, but coming that was the closest location to them. We had Hamilton for the western region, and then the most recent one was in Toronto, which was the largest workshop with settlement agencies in the central region. So in total, the workshop was delivered to 60 settlement and employment agency staff members. And so what was really surprising, again, as noted, is that the experience among them was quite diverse. There was people in the room that could have probably presented the workshop better than I could have. And then there was other people that were really just getting involved and really, really wanting to figure out the best ways to present information and support their clients. Sorry? Oh yeah, I'll go super fast. So oh yeah, okay. Yes, yeah. So we started off, and yeah, I'll hurry up, and there's only a few slides, but we started off the workshop with a quick case study that we wanted to share with the settlement agents to really get an idea of whether this resonated with their experience, if this was something that they've seen, to really set the stage with for the conversation in the workshop, and also so that we could really adapt what we're offering to really meet what they're seeing. So this case study is actually a real-life case study that we've encountered at our clinics, at our Hamilton clinic, the occupational health clinics for Ontario workers, of a newcomer worker from Cuba that was working at a large renovation store, a renovation supply store. And basically this gentleman, told us that from the beginning, and similarly, I won't go too deep because it's echoing a lot of people's experience, but from day one, he really wanted to prove himself as a very strong worker. He was lifting, what took a couple of his coworkers to lift, he would just go and grab it and try to lift it himself. It was barbecues that he was lifting. And so one day he basically suffered an injury, but was very concerned to report it to supervisors or to employers. He had heard that people had been fired at his workplace. It was a non-unionized workplace as well. And so there was a lot of fear of reporting, and he didn't feel that he wasn't aware of the WSIB or how to really pursue a claim under WSIB, so he didn't file a WSIB claim either. So basically when we saw him, it was quite a few months after the initial injury, and he was having trouble walking, and it was definitely then more of a crisis situation where he was obviously not working and figuring out what he could do. So we used this case study, and we asked the settlement agencies whether this resonated with them, if this was the type of case that they were seeing, and we got the response of yes, that's something that we definitely see, that that level of a situation is definitely what a lot of them were seeing. So I'll kind of speed through this, but key things that and again, this workshop was we still are, and I'm going to mention that IWH is going to pursue a more formal evaluation of this workshop and next steps around their leading the evaluation. But some key kind of findings that we found from these sessions were, and as we all know, the fear and reluctance for newcomers and refugees to speak out, to report their concerns. A big one was the lack of occupational health and safety awareness training. So this is awareness training that was made mandatory for all. So basically in 2013, every worker in Ontario should be receiving this mandatory awareness training, which is introduction to your rights and responsibilities under the Act, what to do if you have concerns, who to report to in very more serious concerns. And we found that the settlement agencies noted that most of their clients were not receiving this training, as Bashak also mentioned. Some of them told us stories of their clients being asked to sign a page that they had received it, but they hadn't received it, or training being provided in English, but not meeting language needs, what have you, that it wasn't really happening as it's supposed to. There was also a lot of kind of concern, and this is something that maybe we don't have time to get into, but as we're tasking, for example, settlement agencies to be providing this information, what is then the onus on supervisors and the employers? As we know under the Act, it is the responsibility of a supervisor and employer to identify hazards and inform workers about their hazards and at the workplace. So settlement agencies often during these workshops really asked us, great, this presentation is great. We understand that we're here and we're almost the first contact for a lot of these communities. So we're here to want to provide them information, but then we're really hoping that doesn't mean that employers and supervisors are being let off the hook for this, right? So there is this onus that what's happening at the workplace should also be focused on. So again, there's quite a few kind of points that we're going to pull together as a more formalized report and share. Basically how then, and I'll skip through a bit, but how we then structured the workshop was to identify, based on the case study that we worked on, what were the main concerns that we had, including number one, that we would want this individual, and in the case of the gentleman from Cuba, one, the concern around the heavy lifting or the unsafe lifting, or this onus to kind of really work hard and push hard and maybe look over hazards that you know that are available because of the reality that they want to prove themselves, or they don't basically want to, you know, they want to make sure that they feel a level of security in their job. We are also concerned at that fear of being fired and not reporting to the supervisor or the employer, and again also very concerned about not reporting to WSIB, because again this injury was quite serious, and the longer that this individual waited, the more complicated the process would be. So we structured the provision of information into categories kind of reflecting those concerns from the case study. So we provided the participants of the workshop with information on how to discuss occupational health and safety hazards with their clients. So it included, IWH has a great toolkit that you can find on their website that they put together of, you know, conversation starters, slide decks to really get the conversation going with newcomers about how to kind of put that lens on when they enter the workplace to be thinking about hazards. But we really wanted to be careful not to make the onus on just them to basically, you know, feel like they're the ones that have to basically identify all the hazards and protect themselves. You know, we made it very clear that there's going to be hazards that, you know, not even the most well-intentioned or well kind of open person's going to know about jobs, and that's why there's that responsibility from supervisors and employers. But yeah, and then we shared information around their awareness training, so the MOL's resources as well as other agencies' resources on how to talk to clients about rights and responsibilities, and as well as workplace compensation. And so we presented a lot of information on WSIB as well. What we really did though is it was really discussion based, and the idea was that, you know, how are these information, so great that we, you know, provide you information with WSIB, and great that you know, if that information actually reaches your clients, but will, you know, even with that information, what are the barriers to that person actually reporting WSIB? So even if they have the information, they know about WSIB, what does it look like on the ground when somebody actually puts in a claim? What does that look like? How can we, from those cases around the room in these workshops, successful cases, non-successful cases, how could we pull that together and even inform ourselves on how to better present then this information to newcomers? So it doesn't just look like, and as Bashak noted, it doesn't just look like a handout. It actually looks like a conversation, a strategic, you know, at times, and unfortunately, you know, because as the resources are set on paper is not necessarily how they're working on the ground. So we shared, and again, I'll hurry, but the last little thing is an example of this in this type of conversation is we shared a case that we participated in with a group of migrant farm workers that were working on a farm north of Toronto. So they were told by their employer that they could not get off of their knees while they were working. They were working with low Chinese vegetables, so they were low to the ground, and their employer said, you know, you have to stay on your knees, and I want you just to shuffle on your knees. So when we saw them clinically, a lot of the workers had quite serious knee issues. And so when we present about MSK issues, we obviously talk to people about the reverse. We want people to change work postures, to, you know, stand up, you know, bend, you know, you're constantly changing to basically give certain muscles a break. Anyways, so eventually those workers got to the point, and we don't see this often among migrant farm workers or other vulnerable groups, but they wanted to report to the Ministry of Labour call center to report this as a case. So that's quite alarming. You tend to see this only in situations where people are fed up and are almost willing to take the risk to lose their jobs. So we don't tend to necessarily push people to be calling the center, but the MOL, but we definitely provide people as the right how to contact the center as a right of all workers. So we you know, provided them the phone number, and in practice what happened was, so they called, they didn't leave their name, but they left the information, and it did trigger an MOL investigation. We were put in the file, in the MOL's file, as a contact because we had kind of provided some background information on the case. So we were in our office one day, and we got a phone call from these MOL inspectors that were on their way to the farm, and they were calling us just to kind of touch base because, again, our name was a contact. And as we started talking, we were a little concerned because, you know, basically the inspectors hadn't been told that this was a group of migrant farm workers. So they hadn't really been, you know, shared with the idea that, you know, you're coming to engage with a vulnerable population. So what are things that you might want to think of as you're going into an inspect? They also weren't told that the workers were Mexican and didn't speak English. So none of the inspectors spoke Spanish, and they were not accompanied by a translator. So as you can kind of tell, the inspection right from the get-go, we said, like, how is this even going to work, you know? And what's unfortunate about the situation is it only really takes one bad experience with, you know, this type of putting yourself at risk to really try to engage with the system. One kind of example that it doesn't work, that resonates through communities, right? And it kind of becomes difficult to really have people establish trust in the resources that we do, that I'm working to put together and offer. This was quite a long time ago, and since we've worked with the MOL, and they've done a great job at responding to those concerns. So now there was even some training to their call centers to really be able to flag these cases, so their inspectors are informed adequately when they go into inspections. But again, this is telling to, you know, we can offer these resources, but we really need to hear about these cases of when they're actually tried to be used or are called upon to really figure out what those fragments or what those inefficiencies are, to really respond so that people don't have to put themselves at risk. And so I'll skip a bunch and just conclude with, you know, this project again is still ongoing, and IWH is going to be leading the evaluation component. But the idea is that now we have, you know, these 3 regional groups of settlement agencies that we then now can communicate with, and we're really hoping to continue to learn from them. And it's definitely not a one-way street. We want to continue to engage with them and then pull it back, reassess resources, reassess strategies, and then be able to present it back to them. So thank you very much, and if anybody's interested in, if you're from settlement agencies, you can talk to myself or Bashak or WSPS as well to collaborate on with us as well. Thank you very much.